welcome to COVID Talk with local health authorities. With me is Dr. Sherri Onyiego, representing Harris County, and Dr. David Persse, representing the City of Houston. This is sponsored by the Rotary Club of Houston, and thank you to past President Kathy Finninger for providing us a ton of questions from our Rotary folks. And I am Stephen Williams, the Director of the Houston Health Department. Let's get on with it. First, on transmission. Only 7.39% of Harris County has been fully vaccinated. What are projected future targets? Well, we know what we want it to be.
Yeah, I mean, I think that we've all heard that, you know, obviously to get us to herd immunity, we do need about 70 to 85% of our population vaccinated. So, yeah.
Any plans to have essential workers wear high filtration masks?
No.
No.
Yeah, I mean, but I guess we
can, but...
Right, I mean, I think one thing we want to make sure is that they do reserve the N95s for our medical professionals. We definitely don't want to be in a situation like that. And obviously, we've had a lot of discussions about what types of masks that they can wear that gives them the adequate protection. But like medical grade masks, we certainly want to reserve those for our medical personnel.
Good point. What protocols should bartenders use to reduce the spread? I see them touching credit cards and then ice to make drinks. Yes, I'm sure you'll say, I should stay home. I was going to say, that means you were in that bar looking at that bartender, but go ahead.
Yeah, I mean, obviously, we always talk about the prevention measures, the 3 W's, and obviously one of those W's is hand hygiene, washing hands. And so certainly most businesses I've seen around town have done a really good job with ensuring that hand hygiene is reinforced. If, you know, obviously with hand sanitizer, so I mean, certainly that would be a very, you know, top priority and a practice that I would hope the businesses will have in place, especially for bartenders like she talked about.
Certainly they're not supposed to be handling money and credit cards and then handling any food stuff, so that's not cool.
Well, the other thing is, if I'm in a bar or a restaurant, I'd be more concerned about making sure people are wearing their masks.
Right.
Because we're seeing that the transmission through objects is not so great, but
That's right.
make sure that, you know, and if you're in a bar, you're taking your mask down and have a drink.
Yeah. The Minnesota Department of Health is tracking a small number of cases where people caught the virus 2 weeks after receiving both shots. They have mild or no symptoms. Are we seeing this?
Still a little bit too early for us to see it. I've not been made aware of any locally, but I do know our epi teams are focusing on such problems. But we've not heard it locally, but we can expect that there will be some of that. The vaccines are not 100% effective, so we'll see some of it.
Okay. Focus Care Nursing Home in Brenham has 9 of 17 residents testing positive who were already vaccinated. Isn't that too high a coincidence at one location?
It is a high number.
Yeah.
There needs to be an investigation on that.
We would look closer at that. Okay, IHME published an article in JAMA about the potential future of the pandemic. It said requiring mask use in the winter months could contribute both to reduce transmission in those settings and cultural change toward accepting mask use as normal. And they're considering other winter behavioral modifications. Is winter not coming up as a factual challenge in recent research?
Well, with this virus, we haven't seen a lot of seasonal differences.
No, we haven't. We haven't. But I guess one thing to point out maybe a little bit that's embedded in that question or in that point is what we know now about how effective masks are. We probably do need to take a lesson from that as we continue to look at other things like flu seasons and things like that.
We do not have flu season this year, really.
Exactly.
Okay. Comment says they know you're not veterinarians. But can you comment on animals like gorillas who are testing positive and are being vaccinated in one zoo? What about our house pets? Do you know what precautions are being taken at the Houston Zoo?
So I do know that, and so there are certain animals, we've seen it in dogs, we've seen it in cats, and they've absolutely seen it in primates. Not to the degree we're seeing it in humans.
No.
I don't know what the Houston Zoo is doing.
No, I haven't. Yeah, and I know we have our veterinary group, and one thing too to keep in mind is that we also send out a veterinary hand out to our regional partners, and so that may be a good source of information as well on things like that.
Okay. If a retailer says masks are necessary, who can they call to enforce it? I fear there will be incidents in stores. There have been incidents in stores.
Well, so really, I mean, my understanding is if you're going to call someone, it has to get to a point where you're going to call the police. And they could then be potentially charged with trespassing if you want to press those charges.
Right.
But short of that, it's going to be just trying to convince people to, to wear the mask. That's your store policy. That's the store rule.
Absolutely. Do we know more about mild COVID cases and whether they can also lead to long-haul COVID?
I don't know if we, I don't know if we know enough about the long haul. I mean, that's what obviously we're learning more and more about this. We talked about this on previous shows. We know that there are some long haul clinics that are available, that are out there that are providing the services. And you typically have seen it with more severe cases of COVID, not so much the mild cases.
Thank you for joining us with COVID-19 Talk with local health authorities. We'll be right back.
If you love concerts and live theater, going to baseball games, and eating in restaurants, inside, if you love parties and the small talk with the guy who makes you iced coffee the right way, then wear a mask and let's beat this virus so we can get back to the things we love. Mask up, America.
Hello, Houston. Now more than ever, communication with our neighbors is critical as we work together to prevent the spread of COVID-19. It's important to get updates about resources, testing, and safety practices. Sign up for neighborhood updates to receive automated voice and text messages in English and Spanish. This new resource is available for anyone interested in receiving messages without needing a smartphone or access to the internet, especially our seniors. To subscribe to neighborhood updates, call 311 today and enroll.
Things could be stranger, but I don't know how. I'm going through changes, through all of the strangeness. I'm going through changes now.
Wash, washy, wash, washy, wash, wash your hands. Scrub them while you sing this song. Wash, washy, wash, washy, wash, wash. Rub your hands and fingers and the places in between. Using soap and water makes your hands so clean. Wash your hands. Great job, you're almost done. 5, 4, 3, 2, 1, now dry.
Wash your hands for 20 seconds, just like Elmo.
Day after day, we set our little routines. Small things we can't forget to do, or we can't afford not to do. We embed them in our brains. We repeat. For our safety, for our family's safety. We just added a few more for everyone's safety. Remember, every time helps, every day counts. Mask up, social distance, wash your hands, get tested, don't stop, don't forget.
Welcome back to COVID-19 Talk with local health authorities. And our next question is actually a comment. Actually, it's encouraging folks to check on their neighbors. It pinpoints a situation where both folks in the household had COVID and needed some assistance with food. The next group of questions on variants. On Monday, you said as of February 22nd, variants were found in 39 wastewater treatment plants. How long does it take to do the genetic sequencing to find out the percentages of each variant?
So they're being done within a week. So I can't remember which day of the week it is that we collect it, but then over the rest of that week they do it and we report it the following week.
Are we able to determine a rough percentage of those infected with any variant who end up in the hospital? Not.
So Methodist is doing a
Yeah,
comprehensive job of sequencing. I don't know that I don't know of anyone else that's doing it to the degree that they are.
Yeah.
And fortunately, they've not seen a lot of the variants in the patients. So it's interesting that we're seeing the wastewater before we're seeing it in the patient population. But to some degree, that's the whole point of wastewater testing, is to find out what's about to happen. And
Right.
That's right.
Have you been able to determine how lethal the variants are compared to the regular strain?
Yeah, I mean, I think that we know that, I think that's the whole point of that. Some of these, when the virus mutates and these variants come about, that some do have some concerns, and some of the mutations that are evolved are insignificant. So, but the ones that are of concern obviously speak to the level of contagiousness, how easily they can spread, if they're associated with increased mortality. And I think that one of the things that we can really take away from some of this information is that we still want to encourage individuals to get the vaccine whenever they're able to, because we still know that the vaccines provide effectiveness even in spite of the variant circulating.
Modifying the question, is there a variant strain that has surfaced in the United States that originated here?
We know about the
California?
California.
I thought there was a New York version.
Yeah.
Yeah, so the answer is yes, there is. Texas is ranked the 48th state with 13.6% vaccination per capita. The governor said that there may be a discrepancy because so many young people are not yet eligible to receive them. What are the issues pushing Texas to such a poor ranking? You're looking at me.
Yeah.
I think there's some discrepancy in what year of data that they're actually using related to Texas. And I know the state has been going back and forth with the feds on this. And I don't know that they've actually come to some conclusion. The thing that people were really checking was whether or not we were getting our proportionate share of vaccine, and that seems to be the case. Many of my friends who swore they would not get a vaccine are now desperate to do so after the announcement that the state is opening. Have you seen this on a widespread basis?
I don't think we have because we're still doing the 1A, 1B when it comes to young folks. But I'm glad to hear the young people
Yes,
are
glad to
getting
hear it,
vaccinated.
yeah.
That's important.
Glad to see the separate sign-up list for the vaccines. Thank you. As more companies come out with their vaccines, how do we decide which is best to take? Well, we're not.
Yeah.
Yeah. I think that's an important point, is that when you hear the statistics about the different vaccines, you got to remember a couple things. One is the studies were not done exactly the same way. They were not done at the same time. The bottom line is that all three of them that are currently available in the U.S. are very effective at keeping you from getting sick enough to declare hospitalization or dying. They're all good at that. That's what you need to worry about.
Yep.
Best vaccine is the one that's available to you at the moment.
That's right. That's right. And I think the other thing to kind of keep in mind too is that when we think about like when we go to get our yearly flu shot, we're not asking what type of, we're just wanting to get a flu shot to get protected. And I think that's, I think that now in this day and age of this pandemic that we just have so much information in the way it is presented. But we haven't typically done that, especially when it comes to other flu vaccines.
Is the U.S. moving toward mandatory vaccinations?
I don't think so.
Yeah.
Are flu shot doses for children different?
Flu shot doses?
Yeah.
Yeah. I mean, I think that, one of the things that we have to keep in mind is that we know that children are not little adults. Their immune systems are different, and so we have to make sure that we're giving them appropriate doses for their.
And even for the elderly, it's a different dose
Absolutely.
for the regular adults.
Okay. Are there any clinical trials in Houston for those under 16 years old?
I believe
Yeah,
it
they
is.
are.
Yeah.
They are.
Clinical trials look at efficacy for the primary outcome, which were COVID symptoms and severe symptomatic COVID. Trials are not designed to look at secondary outcomes like hospitalization. That Atlantic ran an article, The Difference Between Vaccine Matters. Does it matter? We said no.
Yeah, so I'd like to read that article.
Yeah, I haven't read that one, too.
So our docs haven't read the article, but earlier we're saying the best vaccine to take is
the one that's available to you.
Yeah,
That's right.
Absolutely. UT at Austin College of Pharmacy has an innovative, thin, peelable film that can be preserved without refrigeration and taken by mouth. Do you think more people would be more comfortable with a non-injectable vaccine if they can create one for the current virus?
Yeah, there's some people that don't like needles. Sure. Yeah. I remember when I was a kid with the polio vaccine, you come in a sugar cube. And particularly when we get to the point where we're going to be able to vaccinate kids,
Yeah.
right, that may be really advantageous.
That might be advantageous, yeah.
I remember that sugar cube. Okay. Eli Lilly antibody drugs cut the risk of COVID-related hospitalizations and deaths by 87%. In case you need the exact drug, Blaze 1 Phase 3 cohort. I'm not so sure I understand that.
Yeah, I mean, I guess one thing we can say is that we know that these monoclonal antibodies, we actually just had a call this morning talking about that. They're really effective therapies. The main point is that you have to, administer them at the right time. They're certainly more effective for individuals who have mild symptoms, and that you can get them that therapy very early on to help reduce their ability of being hospitalized.
I had a particular case that we dealt with. It's for people who are not yet hospitalized, but it's not for everybody who's in the pre-hospital phase. There's still certain criteria that people need to meet. So not anybody who has mild symptoms would qualify for it. So,
Right.
And the other thing, it's an infusion.
It is an infusion. There certainly is not widespread in its availability. You have to have certainly monitoring protocols in place. And you're right. I mean, there's certainly not everybody with just mild symptoms. You have to have high risk criteria to be able to qualify for the therapy as well.
Thank you for joining us with COVID-19 Talks with local health authorities. We'll be right back.
Houston, we have a problem, more like a pandemic, and now it's all of our responsibility to make sure we end it. So this is a declaration for us, 3rd Ward to 5th Ward. We can't afford to lose this. It doesn't matter which state open first. We cannot allow this virus to get worse. Memorial, Main Street, A-Leaf, Acres, Home, Sugarland, and Sunnyside. Trust, we know it's hard to stay inside of your home, but you are not alone. And when you do leave, mask up. If not for you, then for other Houstonians. River Oaks, West U Heights, Highland Park, Galleria to Greens Point. May we point out to you that keeping your distance is still the safe thing to do. Remember, there are people on the front lines. Show them we still have their best interest in mind. East End, 2nd Ward, Midtown, and MLK. And if we didn't name you, the same is true. We all have a job to do. Please wash your hands and get tested. It's time we invest in this great city, because where others may not have a solution, this is Houston. And we must protect the H.
I hear someone go, "Didn't it come from you guys?"
Strangers cough at me.
Move away from me.
Someone spit towards my direction. All the stereotypes that we've worked so hard to break are just going to be reversed. And I won't let that happen.
We all have to play our part.
I donate my plasma.
I've been making masks.
We deserve respect as much as everybody else.
I'm a firefighter, not a virus.
I'm a mask maker, not a virus.
I'm a nurse.
I'm a delivery woman, chef, a neighbor, artist,
Bus driver.
I'm a doctor.
Fight the virus. Fight the virus.
Todos tenemos nuestras pequeñas rutinas. Cosas que hacemos casi sin pensar y que no podemos olvidar. Que repetimos una y otra vez por nuestra seguridad y por la de nuestra familia. Ahora tuvimos que añadir algunas más para proteger a todos. Cada día cuenta. No te olvides. Ponte la máscara. Distánciate. Lávate las manos. Hazte la prueba. Hazlo siempre. Haz que cuente.
Wash your hands. Avoid sick people and touching your face. There are everyday actions to help prevent the spread of respiratory diseases. Visit cdc.gov/COVID-19. Brought to you by the National Association of Broadcasters and this station.
I work out every day. COVID won't kill me.
I'm 24. COVID won't kill me.
I have antibodies. COVID won't kill me.
It's been a long week. COVID won't kill me.
I'm 25. COVID won't kill me.
I'm partying outside. COVID won't kill me.
I don't need to wear a mask around my friends. COVID won't kill me.
I'm 23. COVID won't kill me.
If I haven't gotten it yet, COVID won't kill me.
I'm young. COVID won't kill me.
Famous last words. Don't let them be yours. Socially distance. Mask up, America.
Hi, I'm Simone Biles. Mask up like a champ to protect yourself and everyone else.
As we reopen our city, it's important that we do it safely. Continue to wear your mask in public.
Wear it like a champ.
Mask up, Houston.
Welcome back to COVID-19 Talk with local health authorities. And we had a text that came in from Carlos. Any word on how long vaccines defense lasts? I heard 3 months. Does that mean we need to take vaccines every 3 months?
No, it's not 3 months. The whole point is that you get, well, right now the anticipation is that it'll be at least a year. But to some degree, you know, because the vaccines are new, and even with the original trials, they're measuring that, right? We'll find out. Right? Now, the 3 months probably comes from if you've got a mild infection. After 3 months, we've seen some people get infected again. That's where that 3 months probably come from, but not for the vaccines. But we do have to find out how long the vaccines are going to last.
That's right. That's right. Yeah. I mean, we've heard, absolutely up to a year, and in the studies they kept testing for those neutralizing antibodies, and they were able to check that all throughout the points when people were first enrolled in those trials early last year up until this point. So,
any latest information on phase 3 trials and timeline for AstraZeneca and Novavax?
Yeah, so we had a call this morning where we actually talked about that issue. So Novavax, we think will likely potentially be a fourth available vaccine that's in the queue, probably late April, early spring time frame. AstraZeneca, we know it's approved in other countries. Right now, we just don't have enough information on the landscape of what's happening with it here in the U.S. in terms of being able to predict the timeline. It did show that it had some less efficacy against one of the variants, primarily the South African variant. So, yeah, just don't have a good answer in terms of where we are in terms of the U.S. With AstraZeneca right now.
Please comment on CDC's latest. Vaccinated people can get together without masks.
So I'll say that, you know, people who've been vaccinated, who have been vaccinated, being able to get together without masks, seems to make sense, right? At some point, we'll get, you know, ideally our goal is to have herd immunity through vaccination, right? Well, at that point, I would anticipate we would talk about taking off masks. So in a microcosm, that's where that group of people should be at herd immunity, right? If they're all, the interesting thing is that it says that if you're going to meet with people from one other household who are not vaccinated, provided they don't have any high-risk criteria, then you can take the mask off. And what I read between the lines on that is not the fear that the vaccinated people will become infected by those who weren't vaccinated. It's the opposite. Is that small percentage of vaccinated people who may be unknowingly infected could then infect the unvaccinated folks, and if they've got high risks. So that's why they say don't do that. So, so that was the one thing in there that I thought was between the lines that I thought was interesting.
Yeah, you just answered the next question. It was vaccinated people can visit unvaccinated people.
That's right.
Yeah.
Yeah.
Vaccinated people do not need to quarantine if they were exposed.
Yeah, and they're saying that no testing also if you're asymptomatic. So, you know, that also was part of the recent updates the CDC released.
You're not saying one other thing. The CDC, in my opinion, you know, they're trying to thread the needle, right? This is very, the hardest part of this, and Stephen, you'll remember when we went back a year ago, we talked about the hardest part of this wasn't going to be as things got worse and we became more and more aggressive to try to slow down the virus. We sort of anticipated we were always going to be a little bit behind the curve on that because of just the nature of this particular virus. The hardest part has always been as we start ramping things down. And what do you ramp down? Which restriction do you lift? How much do you restrict it? When do you restrict it? You know, this is, right now, this is the most difficult part. And so to these questions that the CDC is trying to thread that needle, they're coming out a lot of what I think is unfair criticism.
Vaccinated people should still wear masks.
Yeah, and I think that's part of what we're saying. I mean, because until we get to that, you know, until we get to that threshold of the herd immunity, I think that we still need to make sure that those practices are in place.
For future planning, when do you anticipate the CDC and local health official guidance for large groups who are all vaccinated? In other words, when can I go to a concert?
So the challenge with that is going to be, how do you know that they're all vaccinated?
Right.
Yeah, how do you check for that?
So I don't know that we'll see that particular guidance coming out.
Yeah. Headlines from the news, please comment. The sun helps deactivate the virus, and there are few documented cases of outdoor transmission.
So last summer, we looked at the summer weather does, so you look at the R value, and depending on where you read, for this virus, the R value, to remind everyone, is if you were to enter into a room of people who are unvaccinated, how many people would one infected person, how many other folks would that person infect, right? And so an example of really bad is measles, which depending on where you read is like 15 to 20, right? So one infected person goes into a room, can infect 15 to 20 other folks, right? The seasonal flu is a little bit above 1, it's like 1.1. So this virus is in the 2.7 to 3 range when nobody's wearing masks and nobody's social distancing, right? So, so I forgot what the question was again.
Outside, the sun.
Yeah. So what we found was that with the weather, it knocks it down from like 2.75 to like 2.5. So it helps, but not a whole lot.
Yeah, it doesn't negate the risk completely. I think that, you know, obviously outdoor is better than indoor. That ventilation is so key. But if we're outdoors and we're still close to one another, we're shouting at one another,
so it's more
that
about
level of protection is
so it's more about distancing than it is.
So this is where it gets complicated. You're right. It's about distancing outside. It's about, is there a breeze outside to dilute it? The sun and the heat and the humidity doesn't have that big of an impact, but the breeze and the social distancing does.
An estimated 80 million people have already been infected.
That may be about right. There's 330 million Americans. That would be in the
And we could be
20%.
and it could also be an underestimate too. I mean, I think that, one of the things to keep in mind is that 40% of folks are asymptomatic, and folks may have not gotten, those group of folks
That's why
may
these
not get
prevalence
tested.
studies are so
That's
important.
right.
Well, we're about to repeat one, right?
Yeah,
Both on
we
the
are.
city and the county side.
That's right.
From South California Biotech, Dr. Patrick Song stated a phase 1 trial on an oral medication that may block and kill all known variations.
Great.
Yeah.
That means you haven't heard about it.
Yeah.
I've not.
I haven't heard about it.
Our docs haven't heard about that, y'all. And we don't have enough time to Google it to see what it's about. New England Journal of Medicine and Pfizer said Pfizer is effective against UK and Brazil variants.
Yeah.
That's true. Yeah, they recently come out.
Yeah.
Okay. I finished all of the questions, but Dr. Onyiego, I think you have an announcement for us, and then I'll ask you a couple more questions.
Oh, okay. Well, I just wanted to let you all know, thank you so much for these opportunities to just be a part of these discussions. It's been really just a fantastic opportunity, but this will be my last COVID-19 talk with the local health authorities, as I'll be transitioning out of my role with Harris County Public Health.
And you're going to?
So I'll still be here locally. I'll be taking on a different role with a private sector group.
Yeah. Congratulations.
Thank you so much.
Congratulations.
Yeah.
It's really been enjoyable having you here.
Yeah.
David and I made 2 transitions, right? First, it was Umair who was here, and we certainly have enjoyed having you here.
It's been wonderful.
And I hear that the county the court has appointed a new health authority that's coming from Sonoma County, California.
Health director.
That's right.
Yeah, health director, excuse me. Not health authority. Health authority has to be an MD, a licensed MD in the state.
Yeah.
So do you have any parting advice for us as we deal with this COVID situation going forward?
I mean, I think that, I think one of the obvious things that we know is that we're not done with this. I think that, we have to continue to stay vigilant, and I think that obviously public health has such an important role and a voice, and I know that even prior to the pandemic, our voice was oftentimes not heard. We often were not necessarily on the front, on the front in terms of being visible. And I think this has been an opportunity for people to really see the importance and the value that public health brings. And so I really hope that it continues to be an opportunity to just show the wonderful work, the potential of collaborations that public health brings. So.
Yeah, well, I've certainly enjoyed working with you. It's been a pleasure.
It has been. I feel the same way.
Hopefully you'll stay in touch, and I think I owe you a mask.
You do.
I'm getting new orders. I'm going to get you that mask.
Okay.
I usually deliver on my promises.
Okay. Well, we will definitely stay in touch.
So, David, I want you to close this out. Tell us, what can we expect in the next week or two as we go forward with COVID?
Well, I think the next week or two, what we can look forward to, hopefully, is going to be more vaccine coming into Texas. I think, unfortunately, we can look forward to, continued debate about mask wearing. And what I really hope that the public does is that, for proprietors that have the mask rule, please respect that.
Yeah.
Right? They're trying to protect their employees. They've got a lot of customers who are concerned about contracting it. The mask is not a big deal. It is not a political issue. One thing I've said recently is that, people have argued about the governor. The governor is not the enemy. The restrictions and mask wearing, they're not the enemy. The virus is the enemy. Let's keep our mind on that. So I think over this next week, what we can look for is the good news is more vaccines coming in.
That's right.
And that's going to put a burden on people like us and trying to how do we get it to everybody, right? So that's a logistic thing. But let's get away from the politics and protect our neighbors and our loved ones and do the right thing.
Absolutely.
Thank you for joining us for COVID-19 Talk with local health authorities. Next week will be our 28th week doing these talks. And we're really grateful for Rotary and past President Kathy Finninger for providing these questions. I hope they've been informative. We'll see you next week.